What's the actual policy at the moment as it stands?
Sorry?
What's the policy around the co-payment as it stands?
There was the $5 issue and the indexation. They're still there, but the minister, well, it's not due to kick in until the $5 not due to kick in until the 1st of July anyhow.
But so are they official government policy as we?
Well, they are at the moment, yes.
They are?
Yes, and the minister is consulting around a broad range of issues in relation to patient co-payments, and until that consultation's finished, there is no decision one way or the other.
But they remain official, because I got a little confused. I was listening to Mr Tudge on the ABC, and the PM's parliamentary secretary said on 2 occasions in 2 separate interviews the Medicare co-payment scheme has been dropped. He said that on 3AW. He then went on to the ABC and said we've dropped the Medicare co-payments and we're starting again from scratch. I'm still not sure is he right? What's the actual policy at the moment?
As I said, as I have described it, is as I know it, the Minister for Health is doing the consultations.
So can you describe it again as you know it?
The $5 issue is still there, but the Minister is consulting on it and the broader issues around patient contributions. What happens at the end of that process is a matter that comes out of the consultations and a matter for government to decide.
So just again to be clear, you're saying the $5 co-payment is current government policy as far as you understand it?
It is subject to the consultation of the Minister. I'm not going to rule. It's not my job to rule in or rule out government policy.
I just want to know whether something. I mean, this is a pretty straightforward question. Is it the current government policy to have a $5 co-payment, or it's not?
And I've answered that in 3 different ways.
I'll ask the Minister. Minister, I'm confused, genuinely confused. Do we have is the current government policy for a $5 co-payment, or is it not?
Senator, I think the important thing well, there's a couple. The first is the Minister's been extremely clear that she's consulting widely, broad-ranging across the sector. She's also been very clear about the principles of protecting Medicare for the long term, ensuring that those people who are vulnerable and concessional patients are bulk billed, ensuring that we maintain high-quality health care, and also looking at ensuring that those who have got the ability to make a modest contribution do so. And I think she's been very, very clear about that. I think it's been well received that the Minister has, as she said she would do, been consulting widely and broadly, and I think that people are very accepting of allowing that process to run.
Yeah, that's not the question I'm asking. I understand that there's a consultation. I welcome that. I think that's a really positive development. It would have been nice if it had happened a little earlier, but it's a very positive development. It's a very straightforward question. Just needs a yes or no answer. Is the current government policy to introduce a $5 co-payment?
Senator Di Natale, you've now asked the question I
haven't got an answer.
Half a dozen. Well, I think you have had an answer. And
on that, I have answered you, and I said it is still there, subject.
It's still current government policy.
It is subject to the Minister's consultation.